We start with the word wellness because we are the Office of Wellness Education, and really wellness is the space that we're in today, and most of you have joined us to learn more about wellness. But wellness is a word that most people agree on, but very few agree on exactly what its meaning is. And unfortunately, it's an area that is just inundated with misinformation. Unfortunately, many of us get our information from sources like this. And in fact, the problem of misinformation is the topic of our first talk today. But what I want to tell you is that because of the importance of wellness, the importance of being resilient in the face of potential things that might make us ill or unwell, we've become a pretty sick nation. And many of you may know that we are a country that has the most technologically advanced healthcare. We also have the most expensive healthcare and the highest rates of chronic illnesses. No matter what state you live in, we die younger than people in most other countries. And we have an epidemic of chronic illness, much of which is preventable. And the Secretary of Health and Human Services presented last year to the Senate and to the public and really urged us to address this issue. And what he said was that we have to change our ill care system, our illness care system, to a well care or wellness care system. And he said that this is not just a problem of public health, but it's actually a problem of national security because of the severe economic problem that difficult to treat yet preventable chronic illnesses present to us. So as a health system, we take this seriously. And, I draw your attention even to the word health system, because when you look at most health systems, what you find is we're disease response systems. And when you look at how we train our healthcare professionals, whether they're doctors or pharmacists or physical therapists or nurses, we're training them to be disease responders. And our hope is to expand that scope. And I'm proud of our university and our health system for taking that step really earlier than most. And we were helped greatly by a gift from businessman Jim Anderson several years ago to spearhead this office in memory of his dear wife, Jacquelyn Anderson, who sadly passed away in 2021 of cancer. I had the privilege of caring for Jacquelyn as a pain specialist. And one of the most dramatic things I would say about Jacquelyn and her battle with cancer, which sadly was a cancer that wasn't preventable through lifestyle, many are, but not this one, was the resilience that she had because of her adherence to a wellness lifestyle, and how she was able to go through this journey that she had. Jackie was a wellness enthusiast, and she was an artist of some renown and quite a remarkable photographer, and probably photography was her greatest passion. These are some of her images here where she really did beautiful work capturing our region, our state, our country, and the world. She had a passion for nature, and this is some of the work she did with animals, which was her particular passion. And she had a particular passion for dogs and a love for animals. Today, our final talk will be about animals and how they are such a large part of our lives and wellness. So Jackie was a remarkable person. She actually became a sergeant in the Air Force in 1975. But again, the sad part here is a reminder to us all here as we're talking about wellness, that wellness will help improve our quality of life no matter what the duration of our life is, but it won't necessarily allow us to live longer. But in some cases, it will. Not all cancers are preventable, some are. Not all chronic illness is preventable, but some is, and she knew this, and her her resilience really did pay dividends for her as she went through her illness, and I think her family recognized this. So in that, Jim Anderson was faced with Jackie's legacy, and he gave this gift because she wanted to be remembered for wellness and resilience. And part of that was funding an endowed chair at UC Davis. Part of it was funding this office, and part of it was funding an award that is the Jacquelyn Anderson Wellness Innovation Award that raises awareness of the importance and impact of wellness within the university. It honors the outstanding wellness contributions of staff and faculty members here, and particularly recognizes an individual who demonstrates exceptional innovation in research, education, and advocacy in wellness. And I'm pleased to announce that the 2024 Jacquelyn Anderson Wellness Innovation Award was given to Dr. Victor Baquero. Dr. Baquero is a family medicine physician, medical director of the UC Davis Medical Group in Folsom, and a staunch advocate of wellness across our system. He's also been leading the effort to build the UC Davis Folsom campus, which will ultimately be a three-part medical system with spaces and a footprint for expanding the care of medicine to include wellness. He's been a major architect with building this program. He's building a teaching kitchen and spaces where people can have outdoor experiences and other features within a health campus that will be new and novel, supporting individual resilience in healthcare. Now, it turns out that Dr. Baquero is a wellness enthusiast himself. He's a Renaissance physician. He's a chef in training. He's a sommelier. He builds homes. He's just a really unique person and uniquely qualified to help lead this mission with many others of our staff and faculty here at UC Davis. It turns out he's also a photography enthusiast, and these photographs here are ones that he took within the last several weeks at Folsom Lake. But you know, he's a wellness enthusiast and a photographer, much like Jacquelyn Anderson. So with that, I wanted to leave you with this quote from Victor, where he said, "I focus on how to achieve wellness and health through lifestyle, nutrition, and prevention. I would rather recommend a trip to the grocery store or farmer's market over the pharmacy." So with that, it's my honor to give you Victor Baquero, the winner of the Jacquelyn Anderson Wellness Innovation Award for 2024. Victor, you're on.
Scott, thank you so much. I'm so honored by receiving this award. It means so much to me. It's interesting. I've had a long journey in medicine. I graduated from medical school in '98, and in the last 26 years, I've seen healthcare change in many ways. And essentially, it's tougher. The population seems to be getting less healthy, more overweight issues, chronic kidney disease is on the rise. Our challenges are greater. But I've also seen the rise of wellness across medical education and training. And I'm truly impressed with the efforts that you have placed towards involving our wellness education and incorporating it into a medical training. I'm starting to do that as I teach our residents and medical students. And I'm thrilled to have this new campus to focus on wellness, to help our patients live healthier and enjoy a healthier healthcare experience that does not involve necessarily prescribing and treating disease when it happens, but preventing and keeping the population healthier. So I'm really honored to receive this award, and I plan to continue our efforts in our clinic and in our health system to promote wellness across the area. Thank you so much.
Thank you, Victor. We appreciate you and all you do. This is an ongoing effort, and you know, this award was given out by a selection committee that voted unanimously for Victor, but there were many, many others who are deserving, and we are giving out also commendations for wellness innovations across our campus, which will be coming in November from many of the others who were nominated for this award. So more to come here.